Hello, my name is Dr. Kyle Smoot, and I'm a neurologist at the Providence MS Center in Portland, Oregon. And I'm pleased to present a video on balance today. Unfortunately, many people with multiple sclerosis can experience falls, which can have a negative impact on their quality of life. Several studies have indicated that within a 6-month time period, that about 50 to 70% of people with multiple sclerosis had a fall. So why do people with MS have difficulties with balance? And there are many potential reasons that we will discuss today. Because MS is a disorder where the immune system is overactive, this can cause inflammation within both the brain and the spinal cord, specifically your neck, which is your cervical spine, and the part below that, which is the thoracic spine. And lesions anywhere along these paths can contribute to balance difficulties. As you can see here on the right is an MRI of the brain and also the top of the neck, which is the cervical spine. And this is if we're looking at an individual from the side. So if you can see with my arrow, this is all the cerebrum, the main part of the brain. Sitting below that is the cerebellum, which controls a lot of one's balance. And then right in front of this is the brain stem. So we have the midbrain, the pons, and the medulla, and then also you can now see the very top of the spinal cord. Just for interest, here is the tongue. Start to see part of the nose as well. So inflammation or lesions anywhere in the brain or in the cerebellum, in the brainstem, as well as the spinal cord can cause difficulties with balance. So what are some factors that play a role? First is vision. So optic neuritis, which is a common symptom in multiple sclerosis, which can present with loss of vision, pain with eye movement, and a lot of times people have difficulties perceiving colors, particularly red. This can result in problems with balance because obviously your eyesight is not as good. Fortunately, for most people, they recover quickly from optic neuritis, and maybe there may be some slight residual, especially when you're more active or tired. Double vision or diplopia can contribute to difficulties with balance as well. Typically, that's due to a lesion in the brainstem, either maybe in the midbrain or possibly the pons. Weakness, so especially if there's weakness in the lower extremities, and foot drop is very common in people with multiple sclerosis. And if the foot is not clearing a surface, then the toe may catch, and that will result in a person tripping and possibly falling. And this becomes more of an issue, especially on uneven ground. So it's really important to make sure if you have some weakness in your lower extremities, particularly in the feet, that you're picking up your legs to prevent that from occurring. Spasticity is also muscle tightness, which can present with some muscle cramping as well. And this typically affects your hamstrings and your calves. And when the muscles are tight, then that you are not picking up your feet as high as you should. And again, this can lead to lead to falls. A loss of feeling in the lower extremities. So it's very common for people with multiple sclerosis to have difficulties with position sense. So when your neurologist checks your position sense, they're moving your toe and or they're using a tuning fork. And if you have loss of sensation to vibration in the toes, then you have some impairment of your position sense. So you don't know exactly where your feet are being placed in relation to the ground. And this is really important, especially if you're getting up in the middle of the night. So if you take away your vision because it's dark, you're going to have more difficulties with position sense. So using a night light or having some other light on at night can help prevent balance issues and falls. Vertigo, which we typically think as a spinning sensation, can occur in people with multiple sclerosis. And we'll talk about other causes of vertigo in the next slide. But typically, vertigo, if it's due to multiple sclerosis, is constant, and people have a sensation of spinning, and that usually can be due to a lesion within the brainstem or possibly even the cerebellum. And then that leads me to ataxia, which can contribute to balance issues, and again, mostly due to lesions in the cerebellum. So this is a sense of unsteadiness with walking. Patients may also notice that when they're grabbing something, that they may not have a clear trajectory to that item, and so we also call that ataxia or dysmetria. And then fatigue. Um, as you become more tired, your nervous system has to work harder. And because of that, some of the previous symptoms may reappear, and those symptoms may contribute to issues with balance. It's important for us not to always blame everything on our multiple sclerosis. I think both the patients and clinicians are guilty of this. So there are other causes for vertigo. So we try to differentiate vertigo into what we call peripheral process, which would be something involving the inner ear, or a central process, which would be something involving the brain, which we would include multiple sclerosis in that category. So for an inner process, sometimes a viral infection, we call that neuritis, can cause a vertigo, and typically an individual is going to have sinus congestion, fever associated with that. And one of the most common causes of vertigo is called benign paroxysmal positional vertigo, and that typically occurs with changes in position. So the most common presentation is someone that's rolling over in bed. Either they're going to bed, or maybe they're getting up in the morning, and all of a sudden they have a spinning sensation, and then once they stop, then that spinning sensation goes away. Fortunately, that's fixable. A lot of times working with a vestibular therapist. So what happens in those situations is there's a little calcium deposit that's been knocked loose in the inner ear. And so when you turn, the fluid in the ear goes one way and that calcium deposit goes another way, and that causes that sensation of vertigo. And then Meniere's disease can also cause vertigo. Typically, that's also associated with hearing loss and ringing of the ears. Medication can also cause balance issues. And a lot of times it's more that it's going to cause a sensation of dizziness or lightheadedness, feeling like you potentially may pass out. And that we prescribe several medicines that potentially can cause dizziness. Some of our medications that we prescribe for bladder function, particularly if someone has bladder urgency, can cause dizziness. And there are some medicines that we prescribe for neuropathic pain, such as gabapentin or pregabalin, can also cause dizziness. And then non-neurologic related is could be an underlying heart condition. Maybe a heart rate is slower than it should be, or possibly blood pressure is going down. And again, that could be also related to different medications. So, what can you do to improve your balance and potentially prevent falls? One is getting regular eye exams. So, you should be seeing your eye clinician every 1 to 2 years. Even having some slight what we call visual acuity issue can cause some difficulties with your balance. So obviously, that can be corrected by wearing glasses or contacts. Staying active and just finding an activity that you like to do because you're going to stick with that. May that be walking, or looking at taking a yoga class, either going to a yoga studio. A lot of community centers have yoga classes, or potentially taking a yoga class online. And then also Tai Chi is a great way to focus on balance. It also can, both yoga and Tai Chi, focusing on breath and helping reduce anxiety or dealing with stress. Incorporating other balance exercises in your daily routine. So one activity that I always do with patients is having them walk one foot in front of the other. We call that a tandem walk. So practicing that at home, although safely, can potentially help. And also maybe while you're waiting for something to heat up in the microwave is trying to balance on one foot, trying to do that 3 times on each foot and holding as long as you can. And balance is something that can get better with a practice, and it's also good to maybe incorporate several of these things, just not one thing, to help, which might help improve your balance. Stretching. So again, especially if you experience muscle tightness or spasticity, by stretching, that might help relax those muscles, and again, may make your walking more fluid and be able to pick up your feet more, which again, obviously would prevent falling. Strength training and focusing on your core. So the stronger your core, the more likely your balance is going to be better. And if you don't know where to start, a lot of times working with a physical therapist. So a lot of MS clinics have physical therapists that they work with, and you have to remember that the goal of physical therapy is for them to give you exercises and to do those exercises at home. What else can you do to prevent falls? Wearing well-supported shoes, so not wearing flip-flops or shoes that don't have a backing, and then also trying to keep walkways clear. So a lot of times if people have individual rugs, those are that you can easily trip over those because again, it's going to be a change in the surface. Using assistive device. So I know that some people are reluctant to do that, but obviously we don't want you to fall and break something because that's going to be a setback because then you're not going to be as active and may lead to some deconditioning. So may that be a cane or a walker. And I think it's really important to work with a physical therapist if you need to use one of those devices so they make sure that that device is appropriate for you and also is at the right height. If needed, maybe installing handrails bathroom, especially to help get in and out of a shower or up or down off of a toilet. It seems like many falls can occur in a bathroom, and they can be quite painful because obviously bathrooms are usually small, so it's common for people to injure themselves in those situations. Using a shower chair can also be helpful. And then I also already mentioned a night light. So just to, especially if your bedroom's dark or hallway's dark, having maybe a night light that detects motion can help with your balance and prevent falls. Here are just a couple resources that you may find helpful. One is from the Can Do MS organization. They have several videos addressing different types of symptoms, including balance. And then also the National MS Society has a wealth of knowledge, and there's a program called Free from Falls, which you might want to check out. Obviously, this link is quite long, but maybe if you just put in Free from Falls from the National MS Society, the link should come up. So I would like to thank you today for joining me, and hopefully you can incorporate some of these suggestions in your daily life to help improve your balance and prevent falls. Thank you very much.